And we're back at it again. Who'da thunk it?
Beautiful Las Vegas.
It's fabulous. So yeah, we're in this funny time period of the weather because it flips on and off like a switch. So one day it's 40 degrees, one day it's 80 degrees, and then windy, and then
I was just going to say that.
Kind of nice for about 2 weeks, and then it gets hot. So, and again, apologies to my East Coast friends that are still shoveling snow. So.
Yeah. Although it's snowing in the mountains here today, that's why I was told.
It is beautiful. So when you look up and there's snow in the mountains, Nevada, meaning snow-capped for those of you Nevada trivia at home. Yeah.
So how have you been doing? You're always busy.
So yeah, no, life is good. Yeah, we tried not busy for a couple of months, and that was not good at all.
Probably a couple of years.
So yeah, I mean, the not be no, but we didn't do anything for 2 months, and it became in the office. We had this joke. It became someday. And what do you mean? He says, well, someday we'll clean out the closet, and someday we'll rearrange the files, and someday I'm like, well, it's
Someday's
someday.
here.
That's right. Guess what?
Whether you like it or not, it's here.
Someday. And so, of course, we did all of that kind of the maintenance stuff, et cetera, et cetera. So, but yeah, no, things are good now, better, and I think that things are feeling better, and I feel that in the office, and there's, I think, less anxiety, and I think that Las Vegas is coming back to doing what it's best, which is really being the hospitality center of the world. The pools, believe it or not, it's March and the pools are open here, except today because they're high winds.
Right.
But we take care of a lot of the cast, the gals, and some of the guys that work at the pool, and they're very excited about pools.
Yeah, I think it seems like we're going to actually have our regular normal summer. I mean, under the circumstances, that's right. Pretty exciting. Right?
Yes, so hopefully, if the numbers stay down, et cetera, I hope that's we get to the new normal sooner than later. So.
Yes, don't we all? So today we're going to talk about Botox and as a preventative, which is interesting because we've talked about that before. Personally, about like the hyperhidrosis, which is the sweating in the arms and all sorts of things. Let's talk about that.
Sure. So Botox is a terrific drug. It's a drug, and by Botox we will also talk about Dysport and Xeomin and all that. And really, it's like Coke and Pepsi and Royal Crown.
Okay.
And I said that the other day, and I guess I'm dating myself by saying, I mean, RC, well, yeah, Royal Crown. Could be Fanta, could be whatever.
You're not that old.
Yeah. So, but having said that, they all do the same thing. They're all good. There's a little bit of the differences between the two, and you have to be cognizant of that when you put it in. Okay, fine. But by and large, it is a medicine that you put into the muscle. The muscle stops moving so much, and it mellows a line out on top of it. Okay. It was originally brought forward with strabismus, which is this muscle spasm, and then they noticed after treating this, like, hey, the guy's got less crow's feet, and so that kind of came from there. So it's actually been on the market for decades and decades, and then approved really for cosmetic use about 2 decades ago, and it also is used therapeutically for migraines, etc. Now the neurology guys and gals, they put it in different areas, more posterior on the scalp, etc., than we do cosmetically. But even with the cosmetic patients, we've had about 24 patients over the years that say, hey, I don't get headaches anymore, they're not as bad. And you can get a headache for 20 different reasons, right? It can be vaso-occlusive, it can be a bunch of them. But basically, if you're one of those folks that are always staring at the screen or staring at your kids or whatever it might be, and constantly using those muscles, sometimes if that's the cause of that, we have a few people that better headache-wise. But basically, in our hands, we use it for the cosmetic purposes. And to your point, is it used to be for the 40 and 50-year-olds, and now some drift into the 30-year-olds, etc. Right. And we even get some 20-year-olds coming in looking for that. And then those folks really start to have a conversation of, wait a minute, do you really, really need this? Do you really want to start this early? And many of them say, well, I understand, but I'm in the modeling field, or et cetera, and I want to prevent them before we start. So we have a discussion about that, and depending on that particular individual circumstance, then we may proceed or not, or whatever. But we've turned a few people down, actually, a couple weeks ago. She didn't have a wrinkle in her face. I mean, I told her, look, you're bad for business. I said, there's nothing, I don't have anything for you here. But send your mom and grandma. But yeah, so that we do that too, is we say no. And now to your point about Botox for hyperhidrosis, which is excessive sweating, and especially in the axilla, in the armpits, it can really make a big difference. It's really nice. We have lots of family and friends that have done this. We've had, and here it's hot here in Las Vegas in the summer months.
Oh, yes.
And so these salesmen, these poor salesmen, are running around with 120 degrees, and you can't get the car cold enough, fast enough, right?
Yeah.
So basically, so these poor guys.
It always looks tough when you walk in. You have
you're sweating all over the place.
Right.
So yeah, so I've had a couple guys tell me, hey, Doc, I haven't worn a powdered shirt in years and years and years, powder blue shirt in years and years and years, and we do their thing, and they're able to do that. Now, if you play basketball or whatever, you're still going to sweat, but it's kind of that nervous sort of.
Some people have an issue with just normally have an issue with that.
Sure. So yeah, both men and women we have treated successfully with that, and that usually in our hands, Botox in the face tends to last about 4 months. Takes about 4 days to start. About 2 weeks, you kind of know what you have, and then at 4 months, it kind of fades away. Now, my metabolic folks, my folks that are in the gym all the time, they tend to go through it a little bit faster. Those folks that are actresses, hi, welcome aboard. They tend to go through a little faster as well. The folks for the hyperhidrosis, the sweating of the armpits, typically about a year. We can typically get them out a year. Again, it just kind of depends on the individual.
So people that have not had Botox, and I mean, I know people, we've all heard obviously that the term, or Botox, the name, but what's the safety on Botox? So for people just have no idea.
Oh yeah, no. See, it's very, very safe. I mean, tens of millions of patients have had this over the year. It continues to be the number one, I think, most popular quote unquote aesthetic procedure, if you will, and it has such a good therapeutic index that people think that everything's a piece of cake. Again, you have to go to somebody who's well-trained and experienced, in my opinion, because the classic thing is somebody has heavy eyelids, and they're using their frontalis muscle, their muscle in their forehead, to keep their eyebrow up and keep their eyelid out of the way. And if you're a little heavy-handed and you don't recognize that and you wipe out the entire frontalis, the eyebrow will drop, and that's where people say, oh, I had it and it dropped, and blah, blah, blah. Yeah. Well, yeah, you had too much.
And that's no fun.
No fun. No, it's no bueno.
Right.
Botox in that area, and it dropped everything down. So the key there to try to recognize that, again, recognize things before they're a problem, and then modify it. Sometimes I say, look, I'm not doing Botox in your forehead because you're not going to like it. It's really going to drop you. And so that happens too, or we modify it and have people come back in a couple of weeks and tweak it, twerk it a little bit more as well. So so those are all things that we do. The other thing with Botox, which is interesting, is people say, well, hey, can you go ahead and lift my eyebrow? And you cannot really lift the center of the eyebrow, because in the mid-pupillary line where your pupil is and go up, right? So a centimeter above and a centimeter to both sides of that, that's a no-fly zone. And what I mean by that is you don't want Botox in the area because there's this little muscle called the levator palpebrae, right? So if you get Botox, which is like a hook that's on the lid of your eyelid, right? So if you get Botox in that levator palpebrae, the eyelid will drop.
Right, you're going to get the lazy.
No bueno. Yeah, people don't like that at all. Now, you can get a little bit of the very tail of the eyebrow to come up a bit with a couple of drops of Botox, but that you can kind of just get a millimeter or two on the very, very lateral edge. But sometimes that's all people need, and people like that. We have a real spectacular name for that in the office. We call it the little lifty thing. I have to come up.
That's a very technical term.
I have to come up with a better name for that. I have to schmaltz that up somehow. With
it sounds like something that maybe your brother Jack has something to do with.
Something like that. So he's more creative. He would come up with like some great name for it. I haven't done that yet, so we're gonna figure that out.
So it's sort of in the same family, and I mean we've talked about fillers and Juvederm, but that often that's used together with Botox.
Yeah. So again,
which we get on me actually.
So again, it depends on the patient. Usually Botox we like for between the eyes, the forehead, the crow's feet. Sure. Sometimes we use it in a muscle called the depressor angularis, or the DAO, which is on the corner of your mouth and then downward towards your jawline. If sometimes you put a couple drops in there, the corner of the mouth may come up just a little bit. So those folks would have a little bit of a downturn in the ends of the mouth, and they're like, oh gosh, I look like I'm grumpy all the time. RBF.
Some people are.
That's true too.
Different topic, anyway.
Yes, RBF to the max there, and so sometimes we can get that to come up. Also, sometimes in the neck, if people are starting to get some banding in the neck is basically when you kind of fire the muscles in your neck and you get these bands. Those are thickening of the platysma muscle. Well, sometimes we can put a little bit of Botox there and get those to relax and make those look nice too. So in my hands, Botox works like 98% of the time between the eyes and about 60-70% in the neck. And the thing is with the neck, you have to go to somebody who knows what they're doing, knows the anatomy, et cetera, because there's lots of
very careful
named structures in the neck that you don't want it to get into or get Botox into. So again, like anything else, be careful and go to a well-trained, experienced injector.
Right, because there's a lot of people, I mean, and we've talked about that before too, but there's a lot of people doing Botox that maybe aren't necessarily exactly trained to do that.
And just here, and thankfully to the law enforcement here in Las Vegas, they just cracked down on a couple folks that were running a med spa and not doctors, not healthcare people, not anything, and they were putting bad things into people. So, so thankfully, hats off to the law enforcement community to keep us safe from these folks and not using sterile technique. I can go on and on and on. So, but it's all sorts of no bueno.
Let's talk. I mean, since we're there, let's talk a little bit about that, because I know the med spa thing has become very popular, and people see that as maybe a less expensive way, perhaps, to get those things done, but it's also can be very dangerous, right?
Yeah. So, and again, there's plenty for everybody. So, as far as there's plenty of people that want the services, et cetera, et cetera. So this is not a competition thing at all. You know, somebody you can take all my Botox tomorrow, be okay. So, as far as that goes, I enjoy doing it. I like it, and the patients like it too. But I get to go to surgery also, so I have somewhere else to.
But you have the background, the anatomy background, the training.
So basically, and again, there's some really good injectors everywhere. The main thing is safety. Are they following safety protocols, et cetera, et cetera? What's going to happen if something bad happens? Rarely, but it happens. Who's the medical director? You know, who is the doctor that's in charge of all this, and kind of what their plan is. Also, like anything else, if it's too good to be true, it probably is. Because I go to the used to go to the gym pre-pandemic and such, but you grab the little magazine on the way out, and they have ads for $4 a unit Botox, and I can't buy it for that. So if I can't buy it for that,
you got a question.
There's no way that it's the real deal, and so where are these people getting from it? And that's suspect. So so if it's too good of a deal, it probably is. And to that effect, Nevada actually has laws against that. You can only do Botox or fillers in either a hospital or a medical doctor's office.
So somebody that's certified.
So I mean, a doctor's case. So because they were having parties by the pool at the Hard Rock, et cetera, and it was not good. The only exception is if there's a bona fide medical conference in town, you can inject on the strip if it is a medical conference. They went ahead and did that proviso.
Interesting.
Because there's lots and lots of medical conferences here, and so they wanted that one carved out of the law. But other than that, if somebody says, hey, at your neighborhood haircut place, hey, we got some Botox in the back room, that's probably not where you want
to be. Which sounds funny, but that does happen all the time. Yeah,
happens all the time.
Yeah, and we hear, I mean, definitely in Las Vegas too, because we do have a large population of people that are in the public, cocktail waitresses, performers.
Yeah.
Everybody's always looking for a deal, but sometimes it's not a deal.
No, so we say this all the time, that cheap gets expensive fast.
Right.
Because if there's an issue, then it's always going to be more to go ahead and try to get you back to square one.
Yeah.
And again, I may have a skewed view of things because we fix it. So people come into us and like, my one eyebrow's high, one eyebrow's, okay, come in.
Yeah, and it's funny because I people may not know, but I handle your social media, and I see a lot of those questions like, hey, we actually just saw some of that last week, and you feel bad for the people because they spent their money, they had a good intention.
Oh, 100%.
But they just don't know what they're walking into.
Yeah, so ask questions. Don't be afraid to ask what you're never ever going to offend me or a guy like me with questions. So it's okay to 100% okay to ask. It's your face, it's your health.
Yeah. It's important to cover that. we were talking about, you were talking about your story about diagnosing on the street, which is kind of a funny story.
Yeah. So no, we
which leads me into something else. But go ahead. Tell that story.
So the story I told in the operating room the other day, and the topic was so what was training in Philadelphia like, Doc, and especially in the '90s, etc. It was interesting.
Well, you were in the emergency room, right?
Well, yeah, I was. I was all over the place. So
Crazy.
in trauma and emergency. So I was down. Over at St. Agnes Hospital in Philadelphia, which is on Broad and Passyunk, for those of you guys know Philly, and the burn unit was there, and then my buddy Bill Hughes actually runs the burn unit now, and he's moved it over to Jefferson. So in any case, so you get to a point, and we were doing, I guess it was a power weekend, which means basically you came in Friday morning and you left Monday night, right? So you're there. And so you can only eat enough hospital food. And so basically, so I went across the street, kitty corner across the street to McDonald's. I'm like, okay. So I go ahead, and again, I've been wearing the same stuff for 30 years now. So I'm in a pair of scrubs, white coat, right, the usual, and a stethoscope in my pocket. And I walk across the street to McDonald's, right? And I go to McDonald's, I have my little paper sack, whatever, so my fillet of fish. And I'm walking out, and so I look over across the street, and I spot this guy, and you just know he's a little off, right? I mean, not hostile, not threatening, not.
On the streets of Philly, that's very surprising.
He's a little off, and you're like, okay, this is probably going to be interesting here, right? And next, across the street, on one side of Broad Street is St. Agnes, and the other side of the street is Methodist Hospital. Why they put him across the street somewhere, I don't know. But anyway, so this cat comes walking. I'm waiting on the street corner. This cat comes walking across the street, and sure enough, walks right up to me and says, "Hey, you a doctor?" And I'm like, well, yeah.
How'd you figure that one out?
Yeah, what gave that away? So the white coat and the scrubs and this. I'm like, yeah. And he says, I just went to my cardiologist over here at Methodist, and he says I have a murmur. And I'm like, oh, okay. And he says, yeah, what do you think? And I'm like, all right, hold this. And so I hand him my sack lunch.
Like, am I being punked or what?
I take, right. Yeah.
What's going
All right,
on?
100%. I'm looking. And I take my stethoscope out of my pocket. I put it on my ears, and so I'm listening to this guy on the street corner in Philly. You know what I mean? I'm like, yeah. So I take it out of my ears, and I'm like, he's right. Do what he tells you, and give him a lunch back. Oh, hey, and he said, I'm really thankful. Again, nice, but a little off. And he says, hey, thanks, Doc. I really appreciate the second opinion.
Yeah. And by the way, don't eat at McDonald's.
That's right. And I'm like,
I love McDonald's.
Yeah. So yeah, and then the light turned green, and I went that way, and he went that way, and that's it. But that's your typical Philly.
That's funny.
Kind of stuff.
Which kind of leads into I know this happens to you all the time. I know I've actually done this to you, so I apologize. But when friends, family, people that you don't even know meet you, and they know you're a doctor, they start saying, "Hey, I've got this pain. I've got this blah 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 blah."
Oh yeah.
How do you deal with that?
So it happens all the time. It depends on. It kind of depends on the circumstance, and as we were talking earlier, it's funny because you work your tail off in high school and you get to college, right? And you get to college and you really work your tail off. Oh, God, I'm in med school. Okay, right. So you get to medical school, and the first couple of days, they're teaching you, the branches of the aorta. They're teaching you,
anatomy 101. Right?
They're doing biochemistry. Where does the C go on the OH and all that kind of stuff, right? So you're learning all this stuff, and then people. Aunt Gertrude calls you up about their bursitis, or, should I be on an ACE inhibitor versus a beta blocker? And you have absolutely no idea, right? So, you DKS, don't know, yeah. So, and you're like, huh? And so about clinical medicine, right? So yeah, and you just have to say, look, I really don't know. And I learned in medicine, guess what? It's okay to say I don't know. And then
it's important to learn that.
Find a guy that knows, or you can go to library, and because somebody probably wrote it down someplace. Mm-hmm. So the first year of medical school, they teach you how everything goes right in the body, how it's supposed to work. And then the second year, they teach you how it all goes wrong in the body. That's pathology and all that kind of stuff, and pharmacology. And then the year 3 and 4 is actually seeing patients and putting it all together, et cetera, et cetera. But as a second-year student, you think you have everything, because everything starts off with tired and dizzy, or weak and tired, right? And you're a medical student. You're studying your tail off.
You're like,
and
I've got
this. And you're weak and dizzy. So this buddy of mine comes up to me, second year med school. And it says, hey, JJ, he says, I think I have Kuru. I'm like, there's no possible way that you have kuru.
What is kuru? I had to ask.
Kuru. So he says, yeah, but I'm really kind of tired. And I'm like, well, yeah, we're medical. Yeah, we're tired.
Yeah, you're supposed to be tired.
Right? You're supposed to be tired. If you're doing it right, you're supposed to be tired.
Yeah.
And so kuru is this infectious disease that you get. And I think it's New Guinea. I mean, we're going back for 35 years now. So I think it's New Guinea that cannibals get from eating human brains. Okay. Now, by the way, that's the level of
which
minutia.
Is possible. You could possibly get that.
That's the level of minutia that you get in medical school, right? So I'm like, okay, so when's the last time you were in Papua New Guinea?
Yeah, not often.
And when's the last time you ate a human brain? Okay, so you're probably
haven't done that in years,
right? So you probably don't have that. I'd widen my differential diagnosis if I were you, and get some water and have like a decent and get some sleep.
Yeah, right. Sleep. Yeah.
So that would be the thing. So so that happens often. So, but to answer your question is I mean, anybody who knows me knows a few funny things. Typically is on Tuesdays and Fridays. I go to the operating room, and so Mondays and Thursdays, don't ask me to go out because I'm in bed by 9.
Oh yeah, you have a big busy schedule.
Yeah, it's a joke. It's a school night, and that's me. So, but basically, also people know that I'm the wrong guy to ask as far as, especially for Schedule II narcotics. Yeah, wrong.
Right. Yeah.
But even antibiotics or anything else, because I think it depends on the circumstance, or if they're a family member who was actually also a patient, and yes, I've talked to their family physician, et cetera,
the history,
or whatever, it's a whole different thing. But it's actually poor medicine, in as much as you really should, listen to somebody's chest, or maybe have to do the X-ray. But I'm not set up for that. So by and large, folks that know me know that request is kind of going to go nowhere, as far as that kind of goes.
Right.
But that's a big hurdle that I think all of
because you go to parties and this is Dr. Roth.
Well, for me that's the fun part because I love talking about, obviously I have the show I talk about plastic surgery, but you'll appreciate this story. So we go to one of these charity things. So a couple things happen at charity things. One is they figure out that I'm a plastic surgeon. They go, oh, I've got a question.
Exactly.
Well, actually, it's not even I got it. It's, my friend has a question.
I have a scar.
Well, tell your friend, come by the office.
Right.
So at that point, my wife says, all right, I'll see you in 20 minutes, right? She goes away. She
knows how that goes.
She probably could tell the answer at this point. We've been around. She's like, oh, what you need is. I'm like, oh, great. But if two of them come at the same time, right? So if there's this Mrs. Smith and Mrs. Jones, they both come up to me at the same time at a charity thing, and they go, "Hi, Dr. Roth," and then they look at each other, and I'm like, "Oh no!" Right?
Here it comes.
So the lie that I provide, because I do that too, is I say, "Oh, I must have seen you at the Alzheimer's thing, and I must have seen you at the cancer thing," and everybody goes, "Yeah," and they all walk away. So not have any conflict or anything. But anyway, so we're at the. There is a hospital system, the St. Rose Hospital System. They used to have galas, when we used to have galas before the pandemic. And so it's a room full of doctors and healthcare people and everything else. They're raising money. Okay, fine. So we go to this thing. And so she says, my wife says to, my beautiful blushing bride says to me, says, my feet hurt. Could you not talk to everybody on the way out? Because I will. I'll talk to the guy pushing
you like to talk anyways.
I'll talk to everybody, right? The guy screwing the light bulb, whatever. I'll talk to everybody. So, so I go ahead and I talk to maybe a couple of people, and I catch up with her in the portico share where the parking is, right? And she says, okay, well, which one of your degenerate friends did you talk to? I'm like, well, first of all, it's a room full of doctors.
It's very nice.
We're all in suits. Well, there's a couple of notable exceptions, but they're fun. That's okay. It's Vegas.
Exactly.
I got a guy. So, usually my dad's friends. That's a whole other story for another day. But anyways, so a bunch of doctors and stuff like that, all in suits. It's a big night. And I'm like, so I turned to her. I'm like, well, first of all, they're not degenerates, most of them, anyways. And I said, you want to know who I was talking to? She's like, yeah, I want to know who you know. I'm like, Bishop Pepe. I was talking to the bishop, and she's like, oh, you can talk to him. So
he passes.
So and to bring it all home is what was I talking to the bishop about?
Right.
Not theology. He grew up in Philly. He's a Philly guy. So we were talking about cheesesteaks, and we were talking about the Eagles, and we were talking about all that guy stuff, St. Agnes, guy, boy stuff. And she looked at me, and she's like, "You're talking to the bishop about cheesesteaks?" And I'm like, "Well, yeah. He's got enough of theology, religion, and all that kind of stuff.
Exactly.
Yeah, you talk about cheesesteaks once in a while." So
that's fun.
Broad Street. that whole thing. So the Mummers Parade,
Hey,
right? That kind of stuff.
Hey, you gotta love Philly. There's everything is there.
Yes. So and it's since I was there, it's really come a long way and has a bit of its own renaissance, etc.
And actually, an amazing medical facilities.
Oh, it's tremendous. I mean, you have 5 medical schools there, and we used to have conferences that all of us from different medical schools would present, and it was just the amount of research and such that was going on there. It's just was very, very cool.
Tell people how they can find you online.
Sure. So we're all over. The cornerstone is the website, which is www.jjrothmd.com, jjrothmd.com, and social media. We're all over there as well, and we're working hard to be even more over there, in as much as we have Facebook, we have Instagram, we have Twitter, we have LinkedIn, we have TikTok, we have MySpace. I think we have Friendster. I'm not really sure.
So much. I know.
It's preposterous. So, but having said that, yeah, and we check it. And so if you have questions, and please call us to the office. We actually answer the phone with a human being, and so we're happy to do that. You can call us, you can email us, you can set up a smoke signal, whatever you like. And if there's a topic involved, we usually will go ahead and cover that.
Yeah, and you've actually started a little video clip series. We get questions.
We get questions, yeah. So and that's it's on our various platforms, including YouTube as well. And we're trying to highlight some of the questions that we get asked often, and not only about plastic surgery, but also about growing up in Vegas, et cetera, et cetera. So that's been kind of fun as well.
Yeah, we're having fun with that. Thank you so much, everybody, for joining us, and please check us out on all podcast outlets. And there's a whole long list, which includes Spotify, iHeartRadio, Apple Podcasts, Google Podcasts, Amazon Music. It's a very long list. But thank you so much, and have a great day. And thank you, Dr.
Thank you
Roth.
very much. Always a good time.
Yeah, absolutely. Have a great day, everybody.